Hi, I'm Dr. Ellen Marmur. I'm a board-certified dermatologist in New York City, and today we're going to do hand filler to soften the look of the back of the hands. What is filler? Filler looks like hair gel. It's in a syringe and it's about a teaspoon of gel. And in that gel are these little tiny molecules called hyaluronic acid. Hyaluronic acid is in all plants and all animals, and its only job is to hold water. Today we're treating Barbara. I've known Barbara for many years. The first thing I'm gonna do is evaluate Barbara's hands. We place her hands on a tray in a relaxed, kind of flat position. And typically what works best is if we think about these spaces between the fingers, and we're gonna try to soften some of those valleys and shadows there. Sound good?
Yeah, definitely.
Then I'm going to hold up the skin, evaluate the elasticity, and also find a safe place to inject the filler. So you could pinch and pull the top of your skin. That's called tenting. And if your skin bounces right back, like mine do, that means I have good elasticity. So go ahead and try that yourselves, and you can test your own elasticity. If your skin kind of tense up and sort of stays wrinkled a little bit, then your elasticity is going bye-bye. You need to use more sun protection. We can use some lasers to improve that elasticity, and also we can use some filler to improve it. This procedure is going to take me between 15 and 20 minutes. The filler I'm going to use today is called Restylane Lift, one of those hyaluronic acids that's safe to use, FDA cleared for the back of the hands, and reversible. When I inject the filler, I'm using a needle with lidocaine, which is numbing and makes the procedure very comfortable. Here we go. That's tenting, and you'll feel a little bit of the needle going in, and you'll see the filler coming right into play. Do you see that?
Mm-hmm. Wow.
And then make a gentle fist, and you can see where the filler is. Relax your hand a little bit. And then we just press it right along, and then you'll start to see right away an improvement. Sometimes when I'm injecting the back of the hand, you'll see the filler bump up. There's so much anatomy in the back of the hands and these little compartments. And what I'll do is just massage the hand, and you'll see the filler stream out and look great. The ideal candidate for filler in the hands is somebody who has skinny hands, prominent veins, or prominent tendons on their hands. So once you're numb, you can't really feel anything. So that was one syringe, and I think you definitely need a second syringe. The reason we're gonna do a second syringe is because now that we made this look really good, we still have leftover areas. And I find that people really want this particular area to look great because that's what they see when they're holding their margarita. So we always wanna make sure we get the whole span of the back of the hand. As we age, we lose a little volume of skin, muscle, collagen, even bone. We use fillers to resculpt the body and the face to give some nice natural volume. There's no cookbook way of deciding what filler to put where, and the more experienced dermatologists are going to have a whole pantry full of different kinds of fillers. We look at fillers based on how viscous they are, meaning if you think of honey versus water versus Jell-O, you would think about viscosity in terms of how much lift or how much volume or how much rigidity you're getting from that filler. So we're really only 1 to 2 millimeters under the top of the skin. Depending on where you inject, the pain is different. In our studies, we were found that injecting between the knuckles, interdigital space is what we call it, is less painful. But afterward, it can feel a little bit like a bruise because you can have some small bruising in that area. This looks so good. Yeah, so you can see here, this is a little bit more crinkled, and this is a lot smoother.
Yeah.
The whiteness of the skin is partially from the lidocaine, so that's gonna go away. And then all of these little injection points are gonna go away in about 20 minutes. And then we can see here also the difference. You wanna make a gentle fist with the other hand too. That's nice to show too, that's gonna stay really nicely.
Yeah, all that veininess is gone, and all those valleys are filled in. It's really nice.
This hand is a little different. This hand is a little skinnier over here. We're going straight into the area, pulling up the skin. How you doing?
Fine.
And then it just streams right through the skin. So your body water will hydrate over the next couple of days. So when people get swelling, it's usually for the first 3 days, and then everything balances out. So from your perspective, where do you think you need it now? Right here?
Yeah, right there, and there, and there, and there.
Yeah. And I love to look at from the from your perspective, where you see it, because I agree. So we're gonna clean you and then start on your fingers.
Okay.
The next one I'm gonna use here is called Bellatero Balance, okay? It has lidocaine in it, and it is just a finer filler. This one can hydrate a good amount, so I'm gonna undertreat you on purpose, okay? And here, it's more painful when we come closer to the tip of the finger, so I'm gonna start back here.
Okay.
Once I finish with the hands, I always look at the knuckles and the fingers as well. Believe it or not, finger filler looks so good in people who have hand eczema, and it might even help with hydration of the skin from underneath upward. Doing Barbara's fingers in a couple of spots here just so that it all looks so good together to have the hands and fingers as one nice cosmetic unit looking great. I tend not to go over the knuckle space. You know, everyone's sort of used to seeing knuckles that have a little bit of wrinkling on them.
Yeah.
It would just take a lot of filler to get rid of those wrinkles, and then you'd have weird knuckles. So what we're doing now is trying to make the space around the knuckles look better. We are gonna use about a half of a syringe per hand on your fingers, compared to 2 syringes per hand with the Restylane Lift hand fillers. Don't you see the difference in the elasticity here? Amazing.
Yeah, all those little tiny
That's crazy.
Yeah.
Looks good.
My hands last 20 years.
And no one will say, did you get your hands filled?
Right. That's great. Thank you so much.
Looks good.
I feel better. You know, all of these little things that we can do, they just help you feel better about yourself, and they make you feel a bit more confident. And,
yeah.
You know, we're all aging, and you know, if we can do it and look our best, it just makes a difference.
Yeah,
so thank you.
You're welcome. I'm glad you did it.
Me too.
So the aftercare, we're gonna keep you here until all the little things stop bleeding, which is about 5 minutes.
Okay.
Then we're gonna wash you off and moisturize you. Then we're going to put some sunscreen on your hands, and then you're on your way.
Okay.
So I'd say today I wouldn't do any hot yoga, anything that would increase blood flow and bruising. I wouldn't do any biking today, anything that's like really grippy.
Yeah.
You shouldn't have any pain. You should have a little bit of swelling, especially where we have tiny bruising. Within 3 days, everything should be settling in.
Okay.
And normally I see you back in 2 weeks, and we see if you need we missed a spot, or if anything needs to be tweaked.
Great.
Barbara's going to see her results immediately. Everybody's so different in terms of their duration of filler. So this might last about a year. Barbara can maintain the results and optimize the duration of her results by using sun protection and great moisturizers on her hands for the entire year after she has filler. I don't think that cosmetic is vanity. I think that taking care of yourself cosmetically is just like eating well. It's all about wellness and having that holistic approach to being really motivated to honor your body and this life you're leading and do it in the best way.